part 2 of chapter 1, what is disease? So we've talked about some of the over generalized terminology associated with anatomy and physiology. Now let's talk about disease or pathophysiology. So disease means not functioning properly, at ease, not at ease. Pathology is the study of the disease characteristics, its causes, and its effects. And pathophysiology is the study of the abnormal function of the body. And remember, our goal with medication is return the body back to a normal status. So, as already brought up in the previous slide, terms related to disease, etiology is the cause, and epidemiology is the study of the transmission, frequency of occurrence, distribution, and control of the disease. Now, there's different kinds of diseases. An idiopathic disease is a disease that we don't know what causes it. We can't determine its cause. Unknown. Idiopathic means unknown. In this case, unknown disease, because it's got patho there. Communicable diseases are those that have the potential to spread from person to person or through insect-to-person contact. So most recently in the news is the Zika virus. So the Zika virus is a communicable disease that spread from an insect to a person. And actually it's person to insect and insect to person. Contagious is readily transmitted from one person to another. And those are tracked by the CDC, or the Centers for Disease Control and Prevention. When we talk about communicable diseases, how they cluster. An endemic are diseases that occur within a specific population or region, and they're pretty well contained. An epidemic is where the disease occurs in large numbers over a specific region. And then a pandemic is when the disease spreads over the country or is worldwide. So right now, we have an endemic of Zika. There's a specific population or region in the U.S. located in Miami, Florida, where they have about 17, I believe, patients who've contracted the Zika virus. We're hoping to prevent an epidemic. We don't want large numbers of people contracting this. In other countries in South America and Central America, they are seeing an epidemic. Pandemic would be if it spreads beyond the countries. All right, so going along with your textbook, the next thing after part 2 is a test your knowledge. So now you have an opportunity to answer some questions. Indicate whether the following examples are gross anatomy, which is macroscopic anatomy, or microscopic anatomy, which is also known as fine anatomy. Viewing an X-ray to determine the type of bone break.